Good morning. God's kingdom is at hand, the channel that talks all things care in complete confidence. For as a professional carer educated to managerial level and excelled, I know firsthand how hard it is to care for somebody, especially those caring for their loved ones. But unlike the families I have cared for and I am caring for and supporting, caring for someone can be extremely hard. It's extremely difficult, emotionally and physically. It is demanding. So on this channel, we talk in complete confidence, giving you carers a room and space to air out whatever you are feeling or have felt, whether it being good or bad, thoughts that you may have had, or maybe now you're even feeling guilty about it. I want you to know that you are not alone. This is the purpose of this channel. You are not alone. Today I'm talking about the importance of respite. Respite is not only important to the carer, but also to the person who is being cared for, because it gives the carer a chance to regroup, re-energize yourself, to release some stress that the caring process does. Unfortunately, no matter how much you love your family member whom you're caring for, it does put a lot of stress upon yourself, whether you would like to admit it or not. It is very stressful, it is very demanding, and it's important that you take care of yourself in order for you to take care of your loved one. Otherwise, you'll find yourself snapping. You'll find yourself getting angry and then agitated, and then in turn making the person whom you are caring for also agitated and feeling some type of way, either as a feeling as a burden towards yourself if you are a child of the person you are caring for example. I can tell you, I know of family members, daughters and sons who had taken on caring for their mother in such a great deal. They did such a great job caring for their loved one, but it was so demanding and without taking any respite at all, day in and day out, day in, day out, not getting enough sleep, probably 2 hours a day. Sometimes even going probably about 4 hours a day, sometimes not having any sleep at all between them, and the blood pressures built up. And then finally, one of the children actually, because of the high blood pressure, collapsed. It was too much, and they could not see themselves putting their mother in care just so that they could have that break for themselves, so that they can regroup for themselves. They could not do that, especially the main reason being because of the way the care system is nowadays, the lack of staff in the care system, meaning that they refer to them as patients. I refer to clients as a child of God. So the children of God are left to sleep in their own feces and their own urine for hours on end, waiting for a carer to come round to assist them. This is one of the things that causes a lot of problems for carers, which stops carers from seeking the help that they so desperately need. And this is the only help that is going to enable you to move forward. It is so important. No matter what you think about the care system, go in, have a look around, check the place out. You can usually tell if it's a good place by the smell of the care home. You can usually tell by the attitude of the staff. You can usually tell by looking at the people, the children of God who are seated around within the communal area. If they look droopy, down, unenergetic, without life. But somewhere where there is lots of life, you can see, oh, this is a good place. And please do take that on board. It is so important, because you are not going to assist your sibling or the person of whom you're caring for by not caring for yourself.